Obamacare will eviscerate the core foundations of a robust and successful health care system. They also want to make clear that Congress must not rest until it has defunded, delayed, repealed, and replaced this monstrosity. Joining us, two of the authors of the recently released e-book, Not What the Doctors Ordered, The Sickening Impact of Obamacare. Joining us now, Congressman Paul Broun, who served as a medical officer in the U.S. Navy, has practiced general medicine for most of his career, and is, of course, now a congressman, and David Bossie, president of Citizens United Foundation. Good, gentlemen, to have you both here. The president, Congressman, makes it clear. He understands there have been a few little problems, but he's not going to put up with anybody repealing it or pushing it aside. Your reaction?
Lou, the problem is Obamacare in itself. All of the things that you just mentioned are just a reflection, just symptoms of a law that is totally flawed. We must repeal it. We must replace it. And there are solutions. In fact, my Patient Option Act would put patients in charge of their own health care decisions. They could keep their doctor. A mom who has a sick child could go to the doctor that she wanted to go to, and she and the doctor could decide what kind of treatment that sick child needs to have. That also, mom who's taking care of her sick mom and pop or elderly parents will have the peace of mind that she will know that her parents can get good quality health care. But Obamacare is destroying the quality of health care. We already see that it's hurting our economy. It's hurting job creation here in Georgia as well as across the nation. In fact, I had one employer who has over 200 full-time employees, told me that he was going to let them all go and hire part-time employees just because of Obamacare.
Seeking to avoid having to pay for Obamacare, for health care insurance. Right. This new e-book, Not What the Doctors Ordered. David Bossie, Paul Broun, and John Fleming, Andy Harris, among other congressmen joining in this effort. The sickening impact of Obamacare. Right now, I think that the nation would fairly stipulate that Obamacare doesn't work and most people don't like it. Poll after poll validates that view. Right. What is going to be, and we've just heard Congressman Brown, he talked about a bill he introduced 4 years ago. The Republicans don't seem to have a united voice here.
Well, that's part of the problem, obviously. But, you know, the congressman pointing out that people aren't able to keep their own doctors, as the president promised. But these polls are currently talking about people's dislike with the Obamacare website as they saw the rollout happen, and being able to and coming to the understanding that they may not be able to keep their doctor. Wait until the true ramifications. Doctor shortages in care, lines, the problems that, look, Lou, there are fewer students going into medical school today. Salaries for doctors are down. Doctors are leaving the medical field. We have problem after problem that aren't even being looked at by the American people because they're so focused on a website. I think Congressman Brown, Congressman Fleming, and Harris all see that this thing needs to be torn down and start over. All of us agree that health care is an important issue and there needed to be fixes made, but not by tearing the entire thing down.
Absolutely, Lou. In fact, let me tell you, the employer provided health insurance shoe is going to fall very shortly, because we already see, I see from Georgia, employers that I talk to are going to stop providing health insurance for their employees because they cannot afford the increased premiums. In fact, just in Georgia, it's estimated that insurance premiums are going to go up by 92%. It's been said that 400,000 Georgians could lose their individual health insurance policy. People will not be able to keep their doctor. In fact, we're already seeing doctors thrown off of the panels that are there on Obamacare.
5 million
so people are not going to be able to keep their doctor. They're not going to be able to keep their private insurance. They're not going to be able to afford to pay for the insurance that is provided through Obamacare. It just must be repealed and replaced with something like my Patient Option Act. It cannot be fixed.
So says Congressman Brown. So says David Bossie, and I understand basically the Republican Party on Capitol Hill. But right now, there are two aspects of this that we're looking at that are creating some problems for the Republicans, for the Democrats certainly, and for the nation more importantly. And that is that this ratio, 9 to 7, 9 million people signing up for Medicaid. That was the projected number. 7 million people for Obamacare. And a significant number of that 7, the so-called invincibles, who would be young and healthy and who would be paying much higher premiums than otherwise in order to support unhealthy older Americans. And we're watching this model be torn to pieces. We're also looking at the prospect of $17 trillion in additional unfunded liabilities as a result of the excess numbers moving into Medicaid. David Bossie, what is next here, and what are the Republican solutions?
Well, we know there's a problem, Lou, when the New York Times admits that there's a problem. Look, when the biggest cheerleader for Obamacare comes out and says, look, 9 million people in only 26 states have already signed up to Medicaid. This is a huge financial burden, a huge problem that is going to blow our budgets and our deficit apart. That is what the American people are looking at, and that's why,
well, actually, the American people aren't looking at that, if I may, David.
You're right.
You know, they may, as they read your book, as they listen to Dr. Brown and his colleagues. But the reality is, we are looking at a train wreck that, and the expression was used to describe a website. It is so monumentally, massively more than that, that it's incomprehensible. The numbers, $17 trillion, 9 million people added to the Medicaid rolls. We're looking at an explosion of entitlement and debt and possibly devastation to the deficit and to the country if we don't get in charge of it. And this president seems to have no sense of what to do. We'll find out if and I'm going to give you the last word here, Congressman, but it seems the Republicans don't have the answers either.
Well, Lou, you're absolutely correct. It's monumental. It needs to be totally ripped out by the roots and replaced with something such as my Patient Option Act. We do have some Republicans and Democrats that want to fix it. In fact, my colleague from Georgia, Jack Kingston, wants to fix it. It's not fixable. We've got to get rid of Obamacare because of all the things that you're saying. People are going to lose their doctors. In fact, they're going to lose their insurance. The promises made by this president are totally false. He's delusional if he thinks that people are going to like Obamacare. I've got the plan, the Patient Option Act, and I'm going to continue to try to get it passed into law. And the American people can get it passed into law by demanding it from their elected representatives.
Congressman, thanks so much for being here.
Thanks,
Congressman
Lou.
Paul Broun. David Bossie, the head of Citizens United, good to have you with us. The e-book is Not What the Doctors Ordered, The Sickening Impact of Obamacare. You can get that free going to citizensunited.org or citizensunitedfoundation.com. Congratulations.